5 signs an elderly person may be in their final year. Subtle warnings you shouldn't ignore. It's a profound and often difficult realization for many families when they start noticing subtle yet significant changes in a beloved elderly individual over the course of a year. While the common assumption might be that death in old age arrives abruptly, the reality is far more nuanced. The human body, in its intricate wisdom, frequently sends out quiet signals, whispers of transition that can manifest months or even a full year before life's final stage is reached. The primary challenge most people face is the tendency to overlook these early indications. They often appear too small, too insignificant to warrant deep concern, easily dismissed as mere consequences of aging. It is only in retrospect, as families look back, that the clarity emerges, revealing how those initial clues were present all along. Sadly, by then, the window for preparation, for truly making those precious final memories count, may have closed. This video aims to illuminate 5 critical signs that commonly emerge in the year preceding an elderly person's passing. Some of these might be changes you've already observed, but perhaps attributed to the natural progression of age. Others might be seemingly minor shifts that, in reality, signal a more profound and gradual decline of the body. The immense value of recognizing these signs early lies in the unparalleled opportunity it affords, the chance to provide more attuned and compassionate care, to deeply cherish meaningful moments, and, most importantly, to ensure that your loved one's final chapter is imbued with comfort, dignity, and a profound sense of peace. Please stay with us until the end, as these 5 indicators can serve as invaluable guides, equipping you emotionally and practically for the journey ahead. Understanding what is unfolding allows you to navigate this period with foresight, preventing you from being caught unprepared and enabling you to maximize the time you have left with those you hold dear. Now let us begin our exploration of these crucial signs. One of the earliest and most potent indicators that an individual may be approaching the final year of their life is unintentional weight loss. Initially, this might manifest in ways that are easily overlooked. A belt that now requires an extra notch, clothes that seem to hang a little looser than before, or a once hearty appetite that begins to diminish. Many families might dismiss these changes as simply part of the aging process, a natural consequence of getting older. However, the truth is that unexplained weight loss is rarely a benign symptom. It often signifies that the body is no longer efficiently absorbing vital nutrients, that muscle mass is gradually diminishing, and that essential bodily systems are beginning to slow their pace. While aging naturally brings about some loss of muscle tone, a rapid or significant decrease in weight signals a deeper underlying issue. The body might be struggling to digest food effectively, or the individual may no longer be able to process proteins properly, leading to muscle wasting. This loss of physical strength not only impedes mobility, making everyday tasks more challenging, but also significantly increases the risk of falls, weakens the immune system, and renders the person more susceptible to infections. Another significant contributor to weight loss in this final year of life is a change in appetite. Elderly individuals often experience a blunted sense of taste, making food less appealing and enjoyable. They might start skipping meals or consuming much smaller portions. This isn't merely a matter of personal preference, it's a physiological response. The body, sensing its impending transition, begins to reduce its signaling to the brain to seek food as frequently. The cumulative effect of this reduced intake is a deficit in energy, a decline in physical strength, and a general worsening of overall health. Furthermore, the role of underlying medical conditions cannot be overstated. Unexplained weight loss is a common symptom of chronic diseases such as cancer, heart failure, or kidney disease, all of which can be silently progressing for extended periods before more overt symptoms become apparent. Even conditions like depression or cognitive decline can lead to a reduced desire to eat, initiating a downward spiral where the body receives insufficient fuel to sustain itself. While some families attempt to counter this by encouraging increased food intake, offering favorite dishes, or supplementing with nutritional drinks, it's crucial to recognize that if weight loss persists despite these efforts, the issue may transcend dietary adjustments. The body is signaling a deeper transition. At this juncture, forcing large meals might not be beneficial. Instead, prioritizing comfort, offering easily digestible foods, and ensuring adequate hydration can make a more substantial difference in maintaining a satisfactory quality of life. If you observe significant weight loss in an elderly loved one, particularly if they are eating less, feeling weaker, or struggling to remain active, it is imperative to pay close attention. This is more than a physical manifestation. It's the body communicating a message. Understanding this message now can empower you to prepare for the ensuing journey with clarity, compassion, and the ability to imbue every remaining moment with profound meaning. The second profound indicator you might observe is extreme fatigue and weakness, a deep-seated weariness that persists despite rest. This is not simply the occasional tiredness one might feel after a demanding day. It's a pervasive exhaustion that renders even the simplest tasks feel insurmountable. The act of getting out of bed can become an arduous effort. Walking across a room requires significant exertion, and activities that were once routine, such as cooking, dressing, or even engaging in a conversation, begin to feel overwhelmingly draining. This profound fatigue is not merely a natural aspect of aging. It is a clear sign that the body is actively conserving its dwindling energy reserves. As organ function begins to slow, the body prioritizes essential processes. The heart's efficiency decreases, circulation weakens, and muscles receive a reduced supply of oxygen compared to what they once did. This is why many elderly individuals in their final months experience a pervasive sense of weakness, unsteadiness, and an inability to sustain the same level of physical activity they were accustomed to. A critical factor at play is the slowdown of metabolism. The body, designed to produce and utilize energy, redirects its resources as it prepares for its final phase. Instead of fueling movement, the body shifts its focus towards preservation. This explains why individuals in decline may begin to sleep more, require extended naps during the day, and find it increasingly difficult to remain awake for prolonged periods. Some may even experience sudden and dramatic drops in energy levels, appearing perfectly fine one moment and completely depleted the next. Perhaps one of the most heart-wrenching aspects of this process is the emotional toll that fatigue can exact. Seniors who once took immense pride in their independence may begin to feel frustrated, embarrassed, or even ashamed that they can no longer perform tasks they once did effortlessly. This can lead to social withdrawal, a reluctance to engage in conversations, or abandonment of cherished hobbies, not due to a lack of interest, but simply due to an overwhelming lack of energy. This can foster a cycle of isolation, where they eventually stop trying altogether, which can, in turn, accelerate the decline. For families, witnessing a loved one transition from an active, engaged individual to someone profoundly exhausted and withdrawn can be deeply painful. It's easy to mistakenly interpret this as laziness or a need to push through, but the reality is that forcing activity is counterproductive. What truly matters is acknowledging their limitations, allowing them ample rest, and making their remaining days as comfortable and peaceful as possible. If you notice a loved one experiencing persistent, deep fatigue that is not alleviated by rest, consider it a significant sign that their body is undergoing a major transition. This is the time to nurture quiet moments, engage in meaningful conversations, and offer unwavering support without imposing expectations. Ultimately, what is most important is not the quantity of their activities, but that they feel cherished, understood, and at ease. The third significant change to observe in the period leading up to the end of life relates to cognitive confusion or a noticeable withdrawal from social engagement. You might observe that someone who was once mentally sharp and highly engaged begins to experience more frequent memory lapses, struggles to follow conversations, or appears disoriented even in familiar surroundings. They may find themselves repeating stories, forgetting names, or losing track of time, even if they had no prior history of memory issues. These subtle cognitive shifts can emerge months or even a full year before death. This is not simply everyday forgetfulness. The brain, much like any other organ, relies on a consistent and adequate supply of oxygen and nutrients to function optimally. As circulation begins to weaken and the oxygen supply to the brain diminishes, cognitive function inevitably starts to decline. The individual may become easily confused, experience difficulty making decisions, or struggle to recognize people and places they have known intimately for years. In some instances, they might experience brief periods of lucidity, followed by sudden episodes of confusion, almost as if their consciousness is intermittently fading in and out. Another common manifestation of this stage is emotional withdrawal. Individuals nearing the end of life often lose their appetite for social interaction. You might notice them speaking less frequently, engaging less with others, or spending long stretches of time in quiet contemplation. This does not imply a lack of care or affection for their loved ones. Rather, it signifies that their brain is no longer processing emotions and social engagement in the same way. Conversations can become tiring, loud, or stimulating environments can feel overwhelming, and eventually, many seniors retreat into their own internal world. You may also observe shifts in mood and behavior. Some individuals might become more irritable, anxious, or easily frustrated, while others appear unusually calm, detached, or indifferent to matters that once held significant importance for them. This is not merely a personality alteration, it is often a direct consequence of the brain adjusting to the body's overall decline. As cognitive functions slow, the ability to express emotions becomes more challenging, and the person may cease to react to situations in their customary manner. For families, this phase can be particularly distressing. Witnessing a loved one seemingly lose touch with reality or emotionally distance themselves can feel akin to losing them prematurely. However, it is crucial to remember that these changes are beyond their control, rather than attempting to re-engage them in conversations or to force them back into a familiar social context. The most supportive approach is to meet them where they are, speak gently, offer reassurance, and understand that even if they do not always respond verbally, they can still perceive and feel your presence. If you observe a loved one becoming more forgetful, more confused, or less interactive, it is important not to dismiss these changes. They are often early indicators that the body and mind are collectively preparing for the final transition. This is a time that calls for patience, for cherishing quiet moments, and for cultivating an environment that fosters a sense of safety, familiarity, and peace. Because even when words become difficult or cease to be articulated, love and comfort can still be profoundly felt and conveyed. The fourth key sign indicating that an elderly person may be in their final year involves frequent infections and a noticeable delay in healing. As the body begins its natural process of winding down, one of the most evident manifestations is a compromised immune system. You might observe that someone who was rarely susceptible to illness before now seems to catch every passing cold, every bout of the flu, or every minor infection that circulates. What were once minor ailments now require a considerably longer recovery period, and simple wounds, such as small cuts or bruises, take a noticeably longer time to heal. These changes are not random occurrences. They are significant indicators that the body's capacity to defend and repair itself is diminishing. A primary concern during this stage is the increased susceptibility to recurrent infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more prevalent as the immune system weakens. Many families might perceive these as isolated illnesses, but when they begin to occur frequently or take an extended duration to resolve, it often signals that the body is losing its ability to effectively fight back. Even antibiotics, which previously offered swift resolution, may become less effective. The individual may require stronger medications, longer recovery times, or multiple courses of treatment for infections that would have once been considered minor. This occurs because, as circulation slows and organ function declines, the body's overall response to treatment becomes less robust. Another often overlooked issue pertains to chronic wounds. If you notice that small scratches, sores, or bruises are not healing properly, or if they repeatedly reopen, it could be a sign that circulation is compromised. Poor blood flow means that oxygen and essential nutrients are not reaching the skin and tissues efficiently, significantly impeding the healing process. Pressure sores, particularly for individuals with limited mobility, can become a serious concern and, if not diligently managed, can lead to dangerous infections. What is particularly concerning is that infections in the final year of life may not always present with classic symptoms. Instead of a high fever, an elderly person might simply exhibit increased tiredness, greater confusion, or a diminished appetite. In fact, for seniors, a sudden decline in mental alertness can often be the very first warning sign of an infection, preceding other more overt symptoms. This underscores the importance of early recognition of these changes, as it can profoundly impact the level of comfort and support they receive in their final stage of life. For families, witnessing a loved one endure repeated infections can be both frustrating and deeply saddening. There is a natural inclination to pursue aggressive treatments, hoping that one more course of antibiotics or an additional hospital stay will resolve the issue. However, at a certain point, the focus of care often shifts from curative measures to palliative comfort. Ensuring adequate hydration, maintaining skin cleanliness and moisture, and minimizing stress on the body can contribute more significantly to their well-being than another round of medication that may only prolong suffering. The fifth and final crucial sign to monitor involves significant changes in breathing patterns and circulation. As the body prepares for its final phase, noticeable alterations in how an individual breathes and how their blood circulates often become apparent. You might observe that your loved one's breathing has become slower or shallower than usual. At times, their breathing may pause between inhales, or it might develop an irregular rhythm, alternating between rapid breaths and longer silences. Some individuals may experience a gentle, rhythmic breathing pattern known as Cheney-Stokes respiration, characterized by a cyclical progression of deep, rapid breaths followed by extended pauses. While these changes might begin subtly, they tend to become more pronounced and frequent over time. Another common indicator is weakened circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin might appear pale, take on a bluish hue, or develop a mottled appearance, particularly around the fingers and toes. This occurs as the body begins to prioritize blood flow to vital organs, consequently reducing circulation to the extremities. It is a clear indication that the heart's pumping strength is diminishing. Some individuals also experience increased shortness of breath, even with minimal physical exertion. Simple actions like sitting up, speaking, or shifting position might leave them feeling winded or out of breath. You might observe them breathing more through their mouth, or they may abruptly need to pause and catch their breath while conversing. If someone who was once able to walk across a room with ease now struggles to do so, their lung function may be declining. In certain instances, fluid accumulation in the lungs can further complicate breathing, leading to a persistent cough, gurgling sounds, or a sensation of tightness in the chest. While one might initially assume this is mere congestion from a cold, in elderly individuals nearing the end of life, it frequently signifies weakening lung capacity. This can make lying flat uncomfortable, leading them to prefer sleeping propped up on pillows or in a recliner to ease their breathing. For families, witnessing these changes can be deeply unsettling. It is natural to feel a strong urge to intervene, to encourage deeper breaths, or to worry about an impending crisis. However, in many cases, These are simply the body's natural responses as it slows down. There may not always be a way to reverse these physical changes, but there are certainly ways to enhance their comfort. Keeping the room at a cool temperature, using a humidifier, or offering small sips of water can help alleviate discomfort. In some situations, medications or oxygen therapy can provide relief, but the primary focus invariably shifts from attempting to fix the issue to ensuring their comfort. If you observe these signs, changes in breathing, cold extremities, or a bluish tint to the skin, it is essential to pay close attention. These are often strong indicators that the body is conserving energy and that circulation is slowing down. This is a time for presence, for offering reassurance, and for cultivating a peaceful environment where they feel secure and at ease. In these final months or weeks, the most invaluable gifts you can offer are not necessarily medical interventions, but rather comfort, dignity, and the profound knowledge that they are not alone. As we conclude this discussion, let us take a moment to reflect on the critical insights we have shared. Significant weight loss, extreme and persistent fatigue, cognitive confusion and withdrawal, frequent infections with slow healing, and major alterations in breathing and circulation. These 5 signs are commonly observed in the year preceding an elderly person's passing. It is important to note that these signs may not all appear simultaneously, nor are they always immediately obvious. However, when you begin to notice their presence, it signifies that the body is undergoing a profound preparation for its final transition. For many families, acknowledging these changes can be a difficult process. It is a natural human tendency to resist the inevitable, to urge a loved one to eat more, to move more, or to simply push through their exhaustion. Yet, sometimes the most compassionate and effective approach is to listen intently to what their body is communicating. Instead of focusing solely on efforts to reverse the natural course of events, we can redirect our attention towards making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about fostering a fear of death. Rather, it is about cultivating preparedness. When you are able to recognize these indicators early, you are empowered to provide more attentive care, to engage in crucial decision-making processes in advance, and to ensure that your loved one's final months are enveloped in love and dignity. This is a time for deeply cherishing each moment, for sharing cherished stories, and for reinforcing their value and the profound certainty that they are not alone. If you are currently observing these signs in someone dear to you, take a deep breath and remember that you are not navigating this challenging journey in isolation. Many families have walked this path before, and while it is never easy, possessing knowledge of what to expect can provide strength, foster patience, and help you find a measure of peace. Thank you for dedicating your time to this important conversation. We sincerely hope you found the insights shared today to be valuable. We encourage you to share your thoughts and any particular learning that resonated with you in the comments below, and how you plan to integrate this knowledge into your life. Your perspectives are invaluable to us and serve as a significant source of motivation and encouragement. If you found this video helpful, please consider liking, subscribing, and sharing it with others. Your support is instrumental in enabling us to continue producing informative and inspiring content. Thank you for watching, and we eagerly anticipate connecting with you in our next video.